Hi, I'm Elizabeth Kavaler, a physician and surgeon. I'm a urogynecologist and urologist in practice for over 20 years. I run my own private practice, Total Urology Care of New York. I practice urology for both women and men. I see more women because I am a woman, and my specialty training in urologic conditions is specific to women. I have surgical privileges at New York Presbyterian on the Cornell campus, Lenox Hill Hospital, and I spend 2 days each month at Lincoln Medical Center to treat the community in the Bronx. At each hospital, I work with urology and gynecology residents, training them specifically in women's urological health and pelvic reconstructive surgery. I'm a board-certified urologist with an expertise in urologic conditions specific to women. At the end of my own urology residency, I had additional training in conditions specific to women, including urinary tract infections, pelvic pain, pelvic organ prolapse, and female sexual health. I'm interested in women and women's health. When I went to medical school, there were very few women urologists, but even more importantly, very few urologists trained in surgery and the urologic conditions specific to women. As a woman, I feel that I bring a unique and important perspective helping women patients. I've set up my practice to offer a safe place for patients to discuss their very personal urologic issues. We offer the most current technology and newest treatments. I feel like that vision that I had as a young student has been realized at Total Urology Care of New York. The vision that I have is to provide the care that I would want as a patient myself. We have a knowledgeable and compassionate staff and a clean, warm office. We strive to offer everything the patient needs for evaluation, diagnostic testing, and treatment as much as we can offer in one place. We have accredited sonography, an on-site high-complexity laboratory with PCR capability. We use flexible scopes, not rigid scopes, to look inside the bladder. We have state-of-the-art diagnostic tools, and we offer office-based surgery. A visit to a urologist doesn't have to be unpleasant or embarrassing. My vision is to actually create an office experience that our patients and their families would look forward to. I want to empower patients to understand their own bodies and give them the knowledge to help themselves. I approach them as human beings. Patients want to tell their story. That's part of the therapeutic experience. We don't look at them as someone who needs pills or surgery. We look at the patient's whole life and address their urologic problems from there. My staff and I place a special importance on listening to the patients, learning who they are, and counseling them to improve their urologic health. I wrote a book called A Seat on the Aisle, Please: The Essential Guide to Urinary Tract Problems in Women. My experience is that women often don't have the language to express what their conditions are. We're prepared for that with our patients, but for women who don't have the opportunity to see us, the book gives them the tools, the words, the language to help them find and communicate with the physician they need. Urology in women has been largely overlooked. My book addresses the urological issues in simple language, helping women understand their bodies and their problems. We're proud of what we offer. That's why we say Total Urology Care cares about you. We really do.